Histamine. Oh God, histamine. I know that if you're listening to this video that's about allergies, you know about histamine. Histamine is not a friend when it's in full blossom in our system. It causes itchy eyes, runny eyes, burning eyes, itchy nose, itchy mouth, hives, even death, because it can cause swelling of your bronchioles and your trachea to the point where you can swell those closed and not be able to breathe. That's called anaphylaxis. Anaphylaxis is an immediate and strong allergic reaction, and that is induced primarily by histamine. Now, seasonal allergies. They may not bring anaphylaxis about, but they can certainly bring the symptoms of burning, itching, sneezing, and congestion. There are some simple tools that you can utilize to either stop those reactions or certainly quiesce them, quiet them. 1. Buffered vitamin C. Buffered form of vitamin C is vitamin C in the calcium, magnesium, and potassium ascorbate form. To get buffered C in that form, you want to get the full complex. Buffered vitamin C is very important in dealing with seasonal allergies. Why? Because C helps the body to metabolize and break down histamine. So if histamine is being released, you also have to get rid of it in the body, and vitamin C helps encourage the metabolism and breakdown of histamine. It also, in the form of a buffered form, also helps to alkalinize the system, which reduces the reactivity from the allergic reaction. Next, quercetin. Quercetin is a natural flavonoid. It's a yellow-colored flavonoid. Actually, it makes yellow onions yellow. And flavonoid is in the natural plant kingdom, or quercetin is a flavonoid in the natural plant kingdom. And quercetin has been found in numerous studies to be a strong antihistamine agent. And one of the ways in which it works, one of the primary ways, is it stabilizes the mast cell. Now, the mast cell is the cell in your body. There are many mast cells, but they are the cells in your body that release histamine. And when quercetin acts as an anti-allergic medication, it stabilizes the mast cell membranes so that they don't so easily release that histamine when they're aggravated by an allergen. So quercetin can help dramatically, and you can take that in an oral form. There is a form of synthetic quercetin called cromolyn, and cromolyn is found in the product nasal crom. Nasal crom is a spray that you can use, a nasal spray that works locally in the nasopharyngeal membranes to stabilize mast cell membranes and reduce the inflammatory reactions in those membranes locally from allergens that you're coming in contact with. So I use that product a lot in this office. 2 squirts twice a day, 3 times a day during allergy season. I even have some of my patients start the vitamin C, the quercetin, and the nasal crom a couple weeks before the onset of their normal allergy season and carry those all the way through to the end of the season. And they do much better. Now, for the itchy eyes, runny eyes, red eyes, one of the products we use here is a homeopathic product called Similison, the Similison complex for allergies. Now, it's very safe, can't damage or hurt your eyes, and you can use it on a regular basis. You can even use it hour to hour if you need to relieve the itchiness and redness of your eyes. It's a very safe product, and we get great reports from it. Lastly is something called Jay's Nose Drops. Now, Jay's Nose Drops is an iodine-containing herbal nose drop, and it can be very effective, especially in the development of early bacterial sinusitis caused by chronic allergic swelling of the membranes in the nose and nasopharyngeal area and sinuses. They cause the congestion and clogging or backup, if you will, of the sinuses that can then set up a bacterial secondary infection. So Jay's nose drops early on. I sometimes have my patients put the nose drops in a neti pot and use that as a nasal sinus flush on a daily basis during the seasonal allergy season for them. And also they can just use the nose drops, a couple drops in the nose every 4 to 6, every 4 to 8 hours to reduce congestion and prevent secondary sinus infections from the allergic sinusitis that they're suffering from. So there are a couple easy to do little tricks to get you through the allergy season. In a lot of my patients, those are just enough to get them through comfortably without having to rely on heavier medications and drugs. Thank you.